Dozens of ex-smokers, e-cigarette advocates, and educators showed up to show opposition at Wednesday's New York City Hall hearing about the controversial proposal to ban e-cigarette use indoors. At the forefront of the fight, ACSH's Dr. Gilbert Ross, who says there simply isn't enough evidence they pose a health risk to justify the ban.
E-cigarettes seem to be a potential public health miracle if we can get overregulation out of the way. The toxicants in the vapor, Dr. Farley said numerous times, we don't know what's in the vapor, we don't know what's in these things. We sure do know what's in the vapor. Nothing harmful is in the vapor. Studies done by Dr. Igor Burstein at Drexel, published in the journal, clearly demonstrated that there were no significant health threats from vapor toxicants.
For the past few years, ACSH has been a vigorous proponent in harm reduction techniques. Dr. Ross says there is no question e-cigarettes work in helping addicted smokers, as echoed by dozens of them in the crowd.
Millions of smokers around the world have voted with their feet, and the market has doubled every year. As you mentioned, these smokers must know something about how effective they are, I think.
New York City's Health Commissioner Dr. Thomas Farley argued e-cigarettes jeopardize the progress made by the city's Smoke-Free Air Act, initiated 12 years ago. E-cigarettes, Farley says, can easily be confused with the real thing. Spike Babian, an ex-smoker and owner of Vape New York in Manhattan and Queens, argued e-cigarettes look far different than a real cigarette. They emit vapor, not smoke, perhaps the most important key point in the debate.
A non-smoker doesn't inhale smoke, and none of those people inhale smoke.
But
you guys keep calling it smoking, but it's not. It's vaping.
Okay, it's vaping, but there is nicotine involved here.
But you inhale nicotine when you use a nicotine inhaler. We don't call them smokers. We don't tell people who chew nicotine gum they're smokers. They're nicotine. There's a difference between a nicotine user and a smoker. And what this Clean Indoor Air Act does is to benefit the public by reducing secondhand smoke.
Right.
Okay? So to tell someone who uses a nicotine inhaler, which is essentially what this is, that they need to stand outside of the smoking area and inhale secondhand smoke to use a smoke-free product is insane. We don't ban water because it looks like vodka. We educate people and tell them it's not.
Dr. Ross was quoted in the New York Times saying the proposed law was, quote, hyper-regulatory, and it really will accomplish nothing except to make other former smokers return to toxic cigarettes. Other media like CBS and the New York Post followed suit. City lawmakers plan to make a decision before the new year. To read more news and commentary on the topic, head to our website, acsha.org.